award-winning television. The eyes of the nation are on Pennsylvania as a key influencer to the 2020 election. PCN has over 25 years of trusted state government coverage. Our network is your platform to connect directly with Pennsylvania voters. Whether it's a presidential race, statewide campaign, or local cause, our viewers are ready to hear from you. Book your ad now. PCN, your access to Pennsylvania voters.
The Pennsylvania Supreme Court on PCN. Check PCNTV.com for listings.
We have three branches of government: executive, legislative, and judicial.
Voting is a civic duty. Voters are an integral part in government operations.
When I run for office, you can be my campaign manager.
Do you have a child curious about civic engagement? Support their passion with PCN Civics 101, a free online resource presented by the Pennsylvania Cable Network. Easy-to-watch videos take learners into the Capitol to see how our state government functions, meant to enhance your child's classroom studies. Go to PCNTV.com to start watching. PCN Civics 101, teaching Pennsylvania politics and policy.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Secretary Teresa Miller of Pennsylvania's Department of Human Services. Thank you for being with us today.
Thanks for having me.
So just for some background, in June, DHS announced the, let me read this, Regional Response Health Collaboration Program. Can you just describe what that program is and why it was necessary?
Sure. So we call it the RICP program for short because it's a handful and mouthful, what you just said. And this program really grew out of a program that we started actually back in March, which was an educational support and clinical coaching program. We called it eSkip. And that program was developed really early on in this pandemic to be a support system for our personal care homes and assisted living facilities in particular, because those types of facilities, they support over 45,000 Pennsylvanians, and they typically don't have clinical staff. And so in the middle of a pandemic, that becomes a real problem, as infection control is obviously incredibly important for these facilities to protect their residents and their staff. So we started the eSkip program to really connect experts in our health systems with the personal care homes and assisted living facilities. They provided technical assistance. They had our Jewish Healthcare Foundation was a part of this endeavor, and they were doing webinars on a weekly basis and just providing information and education to once again support these facilities. So that was a pretty successful effort. And the General Assembly then in May saw that effort and said, hey, we want to expand on that and actually fund it, because it was a voluntary effort under kind of our eSkip program that we started. So they allocated $175 million to what we now call the RICP program, which is really an extension of that program. And now we're also supporting nursing facilities as well. So it's a program really designed to support our congregate care, long-term care facilities that are really housing and serving some of our most vulnerable when we think about this pandemic.
And what were some of the factors that contributed to deciding which facilities would be in this collaborative and what areas they would cover?
Yeah, so we actually did a competitive grant process where we went out and said, who wants to provide these services? And then we heard from various entities and health systems and academic medical centers that they were interested in participating. And then grantees were selected and announced, and now we're off to the races.
The program recently announced a 24/7 call centers, support centers for COVID-19. What kind of services and support will these call centers provide?
Yeah, and this is just one of the supports really provided by these RICP grantees. But it's all of them were required to provide a 24/7 call center, really to be available with their experts, their employees, their clinical staff, to answer any questions that any of these providers, these long-term care facility providers might have. So in the middle of the night, if they find that they've got a situation they're just not sure how to handle, they can pick up the phone and reach out to the healthcare experts and the clinical staff and say, what do I do? They may need people to deploy and come out to them. They may just need some advice about how to handle something. And that's really what this is about. It's about leveraging existing resources, coordinating efforts, and really connecting these facilities that, again, in some cases may not have clinical staff with the clinical expertise of those health systems and academic medical centers.
As you mentioned, some of these long-term healthcare facilities have been very negatively impacted, hit really hard by this pandemic. How are those facilities and these collaboratives helping those facilities prepare for the future, the rest of the year and the fall, as fears of a second wind of this pandemic are starting to come to light?
Right. So I mentioned the 24/7 call centers were one of many things, really, and many supports that are going to be offered by these grantees. So we have the call centers. We also have, today we're having daily calls. We actually have 2 calls a day where we're talking about what's happening out there, what facility is experiencing what, who needs what services. And these are calls that Department of Health are a part of, our Department of Human Services are engaged in, and PEMA, and now our RICP grantees are as well. So they're part of these calls. If we need to deploy a team to go out and help a particular facility with an outbreak or with whatever it is they're dealing with, then we can do that, and that's happening today. We also, the Secretary of Health issued back in June a universal testing order. So all of these long-term care facilities have to complete a baseline universal testing by the end of August. And that's a tall order for some of these facilities, and some of them are struggling to figure out how they're going to meet that requirement. But that's been one of the big pushes with these grantees, is getting them set up to help these facilities meet that requirement. So they're already engaging in assistance to make sure these facilities can complete that testing. And that's doing asymptomatic testing as well. So we're not just testing people who have symptoms, we're testing all residents and staff. And then, of course, contact tracing becomes important. If through that testing you find out about a positive or you find out about an outbreak, then contact tracing is obviously really key. And so our RICP grantees are going to be able to help these programs and these providers with their contact tracing efforts. Additionally, they have to complete at least 2 site visits with each of these providers. So all of our long-term care providers are going to get at least 2 on-site visits from our RICP grantees. So doing an assessment to find out, to your point, to find out, how are you doing so far, given what's coming? Do you have enough PPE on hand? What are you doing about infection controls? And really addressing any questions, but doing that assessment to find out what's going on there, what do we need to be worried about, and how do we plan for the future?
On the topic of planning for the future, beyond this collaborative project, what are yours and DHS's other main concerns or priorities moving forward towards, the fall and the end of the year?
Are you talking about just the kind of long-term care facilities or just generally?
No, generally.
Generally. One of the big issues we've been worried about is, housing. We've been worried about food security, knowing that this pandemic has impacted so many people. And obviously we have the pandemic, and then we have the economic downturn that came right on the heels of this. And so we've got people who are struggling to put food on the table, people who've lost jobs, and that has completely changed their financial circumstances, people who never expected to lose jobs. And so all the things that kind of come with losing incomes, losing jobs, those are all the things that we start to think about. So making sure that people can put food on the table, making sure people know about the programs that we offer, making sure they know Medicaid is an option if they need health care and if they've lost a job that provided health insurance, and that housing assistance is available. So we're trying to do everything we can to get the word out that help is available, particularly now that the unemployment compensation and the additional $600 a week is going away or has gone away. We know that's also going to be one more issue that families have to deal with. And for many of them, that was probably keeping them afloat and making sure that they could put food on the table and could pay their rent. With that going away, we've tried to get word out about assistance that's out there so that families can continue to pay their rent, put food on the table, and do what they need to do to help their families.
And finally, on that topic, as you mentioned, housing and homelessness has become a much more prevalent issue during this pandemic. What are some of the options that people have available to them, or resources that they might have if they are homeless or at risk of being homeless or simply struggling, like you mentioned?
Absolutely. We issued a press release recently talking about funding that we had available through the CARES Act that we allocated to counties' homeless assistance programs. There was $10 million that we allocated to these programs, and that's to help people with rental assistance. It's to help with emergency shelter, with supporting housing services and case management services. So anyone who's at risk of homelessness, I would encourage them to contact their county housing assistance program to see about resources that are available there. Additionally, the Pennsylvania Housing Finance Agency, or PHFA, they're also offering housing-related financial assistance in the form of rental assistance and mortgage assistance. So if someone just needs help, they lost their job back in March, or they've lost 30% or more of their annual income since March, I would encourage them to go to PHFA's website. It's www.phfa.org, and they can learn more about rental assistance and mortgage assistance that's available.
Awesome. All right, Secretary Teresa Miller of Pennsylvania's Department of Human Services, thank you so much for your time.
Thanks so much for having me.
This Sunday on It's History.
Our collection here includes some paper treasures from the Cumberland Valley Railroad, including our daybook, where items being shipped from our Cumberland Valley Railroad warehouse across the street were logged. Everything from a pair of shoes being shipped somewhere up to larger shipments. And of course, the largest industrial shipments would have had contracts.
I'm here with Cheryl Bettigole, Director of Philadelphia's Division of Chronic Disease and Injury Prevention. Thank you for being with us today.
Sure, it's a pleasure. Thanks for having me.
So we've seen that this pandemic has disproportionately affected Black and Brown and underserved communities. What are some of the inequalities that you observed in those communities during this pandemic?
So we are seeing higher rates of infection, higher rates of hospitalization, and higher death rates among Black and Latino city residents. And I think that's been true nationally as well as in other large cities.
And what are some of the social or structural determinants that led to some of these outcomes and inequalities?
So this pandemic is hitting us in the same places that other types of disease hit us, which is that we're a country with a long history of systemic racism. So a history of redlining that means that many Black people in our city and across the country live in more crowded housing where it's more difficult to quarantine or to isolate when a pandemic hits. That history also affects the kinds of jobs people have access to, so that many fewer Black Philadelphians and Black people nationally are able to work remotely. And so people are out there on the front line more at risk of contracting the pandemic. And the way our neighborhoods are laid out, through increased advertising of products like tobacco and junk food, we have more people with chronic conditions like diabetes and heart disease that put them at higher risk if they do contract the virus. So all of those things together equal the disparities that we're seeing.
Your department released the coronavirus interim racial equity plan to try to address some of these issues during the pandemic. What are some of the key elements of this plan?
So this plan really was put together with a lot of thought and collaboration from internal city stakeholders and community members. And it reflects the input we got from them that it was really important that we build trust and that people feel that we are being accountable. So there's a lot of focus on transparency, making data publicly available and making it available by race and by ethnicity and by age groups so that people can see what is actually happening in our neighborhoods and in our city. So that data transparency is very, very important. Making testing available all across the city and in places that people are comfortable. So we looked at who we're testing, and we found that we actually are testing many more Black people than white people, which is a good thing because that's who's getting sick. But that wasn't the perception. So making the information about who's getting tested available publicly so people can see it, but also partnering with trusted partners across the city. So we are seeing lower test rates among Latino city residents. And a piece of that is barriers of trust. We are living at a time when immigrants are afraid in our country. So partnering with groups that they already trust, that are in their communities, so that testing is available in a place people feel comfortable going is another important piece. Having a diverse staff. So we're building a contact tracing unit, making sure that unit looks like the community and is diverse and can be trusted. Contact tracing is something that people have to believe in and trust, or they're not going to share information about who they've been around. So, and then not just doing that, but making the information about that accessible to the public. So you can now on our website see the makeup of who's on the contact tracing team. And the plan includes a few stories from members of that team so that people can get to know them a little bit and understand who they are and why they're doing the work they're doing. The other thing that came up was just making sure that the information we put out not only is clear and often uses graphics, is multilingual, but that we're putting that information out through channels that reach people. So not everybody's on social media, for example.
One of the elements of the plan that I noticed was tracking racial and ethnic disparity, which seems like something that might be difficult to track. What does that process and this data collection entail?
So one of the challenges has been that when labs first come in, they don't necessarily have the race or ethnicity of the person who was tested. So our epidemiology folks are cross-checking with other databases to try to get that information. And that's now available on our phila.gov/COVID site. You can look at data by race and ethnicity for cases, for hospitalizations, for deaths. You can also look at maps to see where in the city people are being tested and where cases are.
You mentioned your diverse contact tracing team and the different entities that are involved in this plan. Who is involved in this, in executing this whole plan, and not just doing the work not in your department, but actually reaching out to the communities and collecting that data that's so important to getting this done?
So the team is made up of people from a variety of city departments, as well as area healthcare institutions, safety net clinics, and community leaders. So that's the racial equity response team, the people who were responsible for helping to create this plan, and also will be meeting monthly to look at progress. In terms of data, so the data on labs and hospitalizations comes in from healthcare institutions. So that those are data feeds, and then we use other databases to cross-check. But the team itself is internal and external. I think one of the things that was clearly going to be important was to get perspectives from outside of city government to just make this stronger.
And another point that was important in the plan was expanding testing. Where are you now in terms of testing, and what are your goals for how much testing you want people to be able to have access to?
So we are now, I believe, at 56 sites with a goal of getting to 75. And we're our eventual goal is to do around 5,000 tests a day. We're currently up to around 2,800 or so. So we're partway there, but not all the way there. But it's not just about, of course, the number of tests and test sites. It's about where they are and who is getting tested. So we're looking at all of those things.
And just to reiterate your point about access to information and how important it is to get that information out there, where can people access not just this plan, but all the information about testing and protective equipment and things like that?
So we have a website, phila.gov/COVID, that has information about testing and data. It also has a guidance. There are downloadable posters and fact sheets, an FAQ for questions, just a lot of information at phila.gov/COVID.
And finally, a lot of these issues that we're talking about existed before COVID-19 and probably won't be solved during this pandemic. Are there plans for this plan to continue even after COVID-19, or are there talks for a plan to go further into addressing these issues even after this pandemic?
Yeah, I mean, that's what we're talking about and thinking about right now is, in the spirit of never waste a good crisis, what can we take from this work to move us forward so that we are in a better place, not just in terms of the pandemic, but in terms of people's health overall.
Awesome. All right. Cheryl Bettigole, Director of Philadelphia's Division of Chronic Disease and Injury Prevention. Thank you so much for your time.
Thank you very much. Take care.
PCN is working to help keep Pennsylvanians informed as restrictions are lifted across the state. Join us for Coronavirus Impact, a discussion with civic, business, and government leaders on COVID-19's impact on life during and after the pandemic in Pennsylvania. Watch on cable and stream free on the PCN app.
I'm here with Andrew Goldstein, staff writer for the Pittsburgh Post-Gazette. Thank you for being with us today.
Thanks for having me. Glad to be here.
So Pittsburgh Public Schools Board last week voted to start schools online. What were some of the voices in that debate that led to that decision?
Well, there were a number of voices in the debate. Obviously, you had the students and parents. You had, of course, the teachers and the teachers union. You had school administrators, but you also had the state, government, and the community at large. I think one of the certainly most important voices in the room, at least in terms of how the board voted, was the teachers union. Obviously, there's thousands of teachers and other staff members in the Pittsburgh Public Schools. From my reporting, a majority of them were nervous about returning to schools, especially right now, because we've seen surges in the COVID-19 cases here in Pittsburgh in the past month or two. So there was that factor, and that was a big factor. We did hear from some parents and students who did want to return to in-person classes. Now, the school administration came up with a plan initially that would have allowed students to return to the classroom in what they called kind of a blended model, which was 2 days of in-person classes per week, and then the other 3 days would be online. Now, of course, anytime you're in a school facility at all, there's going to be that chance for exposure to the virus. So that's why Kevin Carter, the school board member who came up with the resolution to start the first 9 weeks online, that's one of the big reasons that he decided to put that resolution forward, introduce that resolution, and make the first basically grading period of the school year online for the 20 to 21 school year.
Of course, starting students online means that the school has to provide students with devices if they haven't had them already. Have there been any challenges in providing students with those devices?
Well, there have been a number of difficulties getting devices to students. Initially in the spring, when the schools shut down and the school districts really all across the state had to scramble to move to what's called remote instruction, some school districts were better prepared than others. The Pittsburgh public schools and larger school districts all across the country really had the same problems, but the Pittsburgh public schools did not have the number of devices they needed to get to every student. There were also challenges distributing devices because back then we were still in the red and yellow phases of the state's reopening plan, so it was hard for parents and students to get out all the time to collect their devices. So you had this mix of students who were able to get laptops or iPads, but you also had students going to collect work packets at schools. So over the summer and in the spring, of course, the district trying to become what's known as a one-to-one device district, meaning every student will have a district-issued device. The district ordered thousands of laptops and iPads to distribute to students this year. Now, of course, every school district basically in the country, not to mention private schools, universities, all these things, institutions, are trying to do something very similar in case the need for online instruction returns this year. So there's been this national backlog, which we're seeing now has become kind of problematic, especially for Pittsburgh, where there's still about 19,000 devices on backlog that the Pittsburgh Public Schools has ordered. Now, they already had a number of devices that they had in their own stockpile. They also have received several thousand over the summer and many more through donations as well. But the district wanted to have every student get a device by day one of the school year this year. And unfortunately, that looks like it's just not going to be feasible. So they're asking the students whose parents have devices or who might have their own devices to use their own at the start of the school year, while the students who do not will be provided one through the district at an at-need basis.
Of course, according to this plan, students would only start the school year online, and then eventually they would have to go to school physically. What has been some of the discussions or decisions about how they would actually do that? Would they phase in? What are the rules about masks and the guidance about social distancing once they actually go to school?
Well, so you're right. So for the first 9 weeks, the Pittsburgh Public Schools is going to be online. But after that, there's a potential that students will return. Now, students will still have the option to remain online only for this whole school year. And that was a choice given to them by the district as one of the two options. I mentioned the blended option, but there is also the option for students who wish to remain remote out of the school building all year to do that. Now, for those students who are returning to school, what's going to happen is they will be split into two different segments. You'll have your A segment and your B segment. And the A students will be going to classes on Mondays and Tuesdays, and then they'll be online the rest of the week. The B segment will be going to class in person on Thursdays and Fridays, and then, of course, they'll be online Monday through Wednesday. So, and then on Wednesday, the schools will be disinfected, sanitized, all of the cleaning that needs to be done. Now, in the schools themselves, students will be in classrooms with teachers oftentimes rotating instead of having, let's say 15 or 20 students move through the hallways at once. There will also be, when students do have to go out into the hallways, one-way hallways for students to follow. There's going to be all kinds of procedures in place. Students will have to wear masks or some kind of face covering. That was mandated by the state. There are some exceptions for students with special needs or students who have a medical reason why they cannot wear a mask. But most of the time, students and, of course, teachers and staff inside the buildings because of the state mandate, are going to have to wear masks. And, as you can imagine, there is every basically second of the day from before students get into the building to when they leave, there are going to be guidelines for them to follow. Students are hopefully, at least the district is asking parents to give students a symptom screening before they even come to the school in the morning looking for COVID symptoms such as fever or coughing, several other symptoms as well. On school buses, students are going to be seated one child per seat. They're going to, if the weather allows, have windows open to increase airflow. And of course, after every ride, school buses will also be sanitized as well.
You mentioned that the school would monitor people's symptoms and see if they had a temperature. I think perhaps one of the biggest questions in this whole conversation is what happens if somebody gets sick, if it's a student or a teacher. Has anybody offered any solutions to what that situation might require or need?
Yeah, so the guidelines for students who become sick, is kind of still being worked out at the moment. They did, the school board and the school administration has talked about what would happen if a teacher becomes sick. And of course, teachers are actually going to be expected to return to the buildings before students, perhaps as early as a month before students would return to classes in November. They're going to be put in quarantine, sent home. Contact tracing will ensue. It'll be basically like what anyone else would do in an office setting if they would get COVID or COVID symptoms. They'll be asked to go to their physician to see if they should be tested for COVID. If a positive test comes back, then obviously they're going to have to go and seek treatment. If a positive test, or if they test negative, then they have to wait, I believe it's a 72-hour period without symptoms before they'll be allowed to return to the buildings. So they are being cautious. And of course, teachers and staff are being advised to begin with to remain isolated from each other, even if they are in the buildings. So there's only maybe one person per office or classroom, of course.
And finally, this whole conversation about opening schools, similar to the whole pandemic, is changing every day and is always, people continue to change their minds or are unsure of what's going to happen. Allegheny County and Pittsburgh recently had a surge of COVID-19 cases in the past few weeks. If another situation like that would occur, is it possible that all these plans could completely change again?
Well, sure, anything's possible. This is an unprecedented situation, and I know we've heard that word many, many times. But the state actually mandated the shutdowns back in March, and they have not. They said they're not going to shut down schools at this point. But if cases skyrocket again, they still have the power to do that. Of course, local education agencies, such as school boards, have the ability to do it themselves if they feel it's necessary. So here in Pittsburgh, we could see that happen. Any school district could see it happen if there's an outbreak. The school board member who put forward the resolution to delay the start of in-person classes for 9 weeks, Kevin Carter, said that he would consider keeping students remote for another 9 weeks if needed at that point in time. So there's a possibility that we might not see in-person classes, at least in Pittsburgh, until 2021 at the earliest. Of course, it all depends on the path the virus takes, if we see any outbreaks. And, it also depends on the community very much because, schools might do their best and try to be responsible. But if we see, hundreds of cases every day like we had through most of July and into August here, then in all likelihood, the schools are going to remain closed to in-person instruction until that calms down.
All right. Andrew Goldstein, staff writer for the Pittsburgh Post-Gazette. Thank you so much for your time.
Thanks for having me.
Hear stories from Pennsylvanians who served our country with Voices of Veterans on PCN. Service members offer a glimpse into the stories only they can tell.